More on this one, which we touched on last week. I've been reading in the politics page someone talking about the reaction to the second jab he had, but further down someone heard in the news, and I believe it was the BBC News too, that Germany has said the Oxford jab wasn't suitable for the over 65s. This is quite worrying, as I think they're going to be giving this one out more. I'm reading too, the vaccine isn't good for the very fragile old, which my mother is one of them. I don't think we're being given enough information about the reactions. It's not just a case of a sore arm and a headache from what I've been reading of people's experiences.
All the stuff around the vaccines is online. If people go onto the website, they will actually find all the guides to the different vaccines, so they can drill into as much detail as they like in relation to that. In relation to the side effects, these are the side effects that you generally see with all vaccinations. It happens with the flu vaccination as well. You will get potentially flu-like symptoms, a sore arm, so that may include a raised temperature, that may include feeling ill. Generally, it passes after 24 hours. That has been out there since the start of the vaccine when it first came online. These are well-known symptoms. In relation to the over 65s and Germany, it's Germany Public Health that has suggested that, but it is widely disputed in the scientific community. The trials that have been done in over 65s show no difference in efficacy between the over 65s and the under 65s, and the European Medicines Agency disagrees with the German Public Health authorities as well, because they have literally in the last couple of days authorised the vaccine for use in all age groups, and they have come out and said that it does have an efficacy exactly the same in the over 65s group. So in that regard, the comment made by German Public Health is very much out on a limb. It appears that they have been looking wrongly at some of the data, and they've misinterpreted some of the scientific data.
It now looks like the UK may get 3 times as much vaccine as it will need, and there's pressure from them to hand some back. I think they're talking about the EU probably on this one. What is the Isle of Man's position? Because we get a percentage of the UK's dosage. Will we get too much potentially? And then it goes, I presume we will get the vaccinations done much quicker than originally planned.
So we will, but it doesn't mean we get it done any quicker, because the orders, as I've mentioned before, are spread out over between now and the end of September. We have to remember this is a brand new vaccine and has to be manufactured from scratch. And this is what the arguments are about within the EU and wider afield, because the manufacturers have to try and build up capacity to produce the vaccine. So although we are scheduled to receive more than we likely will actually need to vaccinate the population, that supply comes through between now and the end of September. So it doesn't speed up the vaccination programme, having us knowing we're going to get that stock, because we're going to get it over a period. In terms of supply and what we need, we will draw down from the UK what we need to vaccinate the stock. If there's more available to us than we require, then obviously we won't draw that down. It will remain as part of the UK stock. But any decisions around what happens to that UK stock would have to be made by Her Majesty's government.
The CEO of the Health Services appeared on a Q&A this week, but hasn't appeared much with the press. Why is this? Is she still working from the UK?
She is still working from the UK. She's working remotely. I've got to say that Catherine is doing an absolutely brilliant job as CEO of the department. In fact, if you were to look up the phrase remote working, I think it should be her photo held up as an example as to how that works. It has made not a blind bit of difference to the running of the department that she is working remotely. And in fact, she puts in very, very long hours. I have telephone calls and video calls with her at 11:30 at night, 11:45 sometimes, and she's still going. So it hasn't affected it whatsoever. She has done a fair bit in press, but as you would expect in a pandemic, public health leads. DHSC is responsible for the day-to-day medical services, and that's why people will see a lot more of the Director of Public Health, with the Director of Public Health generally being with us at the press conferences, than the Chief Executive of DHSC that has the day-to-day responsibility for the general health services.
Okay, following on from that, it was announced an extra pallet of vaccine had been delivered, much to the surprise of Isle of Man Health. What does this do? Do they put it in the fridge and keep it, or will it be used as and when needed?
So we've received an extra tray of Pfizer vaccine that we weren't expecting in the delivery schedules that became available for us to order. So we ordered it, as we do with all the vaccines, as soon as they become available. We have actually managed to move forward people who were booked for mid-February. So it's a good news story. What we've done as a result is those in the over 80s category that were booked for mid-February, we've been able to move just over 1,000 of those forward to the next few weeks to get them done earlier than expected.
The dash tray has been an interesting addition. How is this updated? You were saying on the press conferences it was being updated every 30 minutes?
No, it's. I think it's 4 times a day it gets updated. The dashboard. If you go online to the page, it does actually say underneath the points during the day when it's actually updated. So it's about 4 times a day the Power BI data that sits behind it is updated.
And this is transparency now, is it?
Well, it is, and it shows as well. We've added to the dashboard actually since it was first launched. We've also added a stock figure, so we know how much, so people can see how much stock we're holding, how much for first dose, and how much for second dose.
I don't know if you had a chance to see an interview I did with Dion Groom, who works on the Isle of Man and has this tracking app and that sort of thing. He said he tried to get hold of you, but you hadn't been able to get back to him. Now, I assumed, and I said, well, I'm not talking on your behalf, but I'm sure you were slightly busy. Have you heard much more about that? Is it something to look at?
It will be in the backlog of emails somewhere, I'm sure. But no, we wouldn't be looking at tracking apps for the reasons that I raised previously. In order for an app to work effectively, you need about 60% of the population to take it up. You also need them to accurately. There's 2 ways of doing it. One is where you scan QR codes, so you need businesses on board to do that, or it actually tracks your data. But equally with an app, because of GDPR and data security, generally the public health authorities aren't allowed to access people's personal data. So if you receive a request to the app to self-isolate, there is absolutely no way of enforcing that people do so. Well, on the Isle of Man, we do direct personal contact tracing with a legal direction notice issued, so that if the person does not self-isolate, they are committing a criminal offence, and that's the system we'll be sticking with.
To be fair to Dion, it's actually a bit more than that. You'd have to watch the video, really, it's because he's got a new twist on the whole thing. But anyway, he's got other countries interested in it. I think we're almost there, Mr. Ashford. But I've got one last question here, which is very time sensitive for Sundays we record this. A few people have actually been putting it on social media as well. Can pubs open at midnight tonight?
Well, depending upon the conditions of their licence, in theory there would be nothing stopping them, and they would only be limited by the conditions of their licence. But I would hope that most pubs would be sensible, and I'm pretty certain the staff of the pubs wouldn't want to be doing that. But
yeah, it's down to their choice and their licensing. I think you said that.
Yeah.
Okay. Well, I suppose as we record this on Sunday morning, you haven't got today's data in the public domain, but there's nothing that you can see, no last minute niches.
As we do this, and if I look at the clock, it's just after 11:15.
Yeah.
There is nothing I'm aware of any concern whatsoever. So there's time yet, obviously, today, but at the moment, being my usual cautious self, it is looking optimistic that we will be able to lift restrictions at 1 minute past midnight tonight.
And what's your interaction going to be with the press and the public, and also Comin meetings? What happens now?
So council and ministers will continue to sit twice weekly. We'll have our usual Thursday meeting, but also a Monday meeting, just so we can keep reviewing the situation as we go forward for the time being. And in relation to the press, we will probably go back to the once a week press conference on a Thursday.
Well, that's okay. So once a week, a catch up. Let's hope it's at that. And unless we get more questions, this might be our last one for a while as well.
Yeah, I mean, as always, Paul, I'm at your disposal whenever you want me. So always happy to do interviews with the press.